For me, professional identity has been a ongoing process that has changed, day to day, week to week, year to year, as I've experienced different patients, different knowledge bases, different experiences from conferences or learning opportunities. But I think at this stage in my career, I would identify myself as a pharmacist, as a medicines champion, as my main professional identity. So I think my central role is to promote the quality use of medications for patients, with a focus of safety for patients, promoting outcomes, making sure that patients are using their medicines to the best potential that's possible through provision of education, training for medication-related devices, providing education to prescribers or staff who may be administering or using medications as well. So championing medicine use through education. We talked about having a multidisciplinary team. I've come to appreciate that part of my professional identity is ensuring they being an effective communicator between other pharmacy staff, patients and professional disciplines, but also as a kind of having a patient-centered focus to my professional identity as well. So all of those aspects as a medicine champion is also kind of dictated by having a patient-centered care focus. And I guess the reason for waking up in the morning and going to work each day for me is partly driven by the fact that I want to help people, and the fundamental focus is on optimising the outcomes for patients and their families. So that's kind of in summary at this stage is where I identify myself as a professional. But in saying that, I think that it's a lifelong journey, and that will change depending on the setting you're in as well. And it's about reflecting, day to day, or if you're having a professional review, it's a good opportunity to stop and reflect on, the last 6 months, for example, and patient journeys you might have been on, or cases that you've been on, and how that may have shifted your focus. And it may have been one where you're a very technical role, because you may have been in a rotation. For example, we have a aseptic production unit, which is primarily a technical role in the manufacture of medicine, so there isn't a huge face-to-face patient interaction. But then as you rotate into a different area, you start to notice that your professional identity changes from one of a less technical to a more patient-focused. So it is an evolution.
But having the understanding of your professional identity and what an ex-phys does, or what a dietitian does, or whatever your health degree may be, you might think is pretty straightforward. But once you come out and start seeing patients and they go, well, I don't like what you're saying, you suddenly have to just maneuver yourself around and maybe go on a little bit of a tangent to what you would usually do, not outside of your practice guidelines and best practice, but what that person wants to make sure that they get the information they need to be able to change their lifestyle, the ultimate goal that they're looking for.
So I would describe my professional identity probably in terms that might seem a little bit outside the box. I'd probably view it more as a co-traveller or a companion. So yes, I have knowledge, skills, expertise and practice wisdom to share with others, but I also believe that others have a knowledge, skills, expertise and practice wisdom to share with me. And if I'm able to take that approach, then I think the collective wisdom that's gained is beneficial to all concerned. The course at UQ certainly prepared me with the knowledge, skills and expertise that I was looking for. I think the practice as a part of the course contributed to the practice wisdom, as did a range of my own personal life experiences. I think that listening and learning with humility and an awareness of our own vulnerability places us in the optimal position for a healthy professional identity that not only keeps us in a place of health and well-being, but also helps us to deliver that to those we seek to live and support around us.